Thank you very much, Maggie, for presenting that perspective from the National Department of Health, and certainly the assuring us of the commitment and political will in terms of trying to address ongoing issues of health workforce distribution in South Africa. We are unfortunately almost out of time for our seminar, but I haven't seen any questions that have been raised in the chat. So I do think we're going to have to draw this to a close, but what I will do in closing is particularly ask our first two speakers if there are any concluding comments that they would like to make. I'm being biased in that, not only because they're the international speakers, but they kept more effectively to time, so I'm giving them an extra chance to say something in closing and reflecting on this afternoon. So Theodora, anything you would like to remark on in closing? Sorry, I'm putting you on the spot here.
Just to say that I really appreciated in the presentations hearing about the use of research in policy making and how the let's say the bridge is being built between research and also policy making. I mean, in particular, I'm thinking of Caressa Gavander's presentation and the potential that that research holds there. And I'd like to just indicate that Dr. Ravengani's presentation was very, very inspiring, and I do look forward to following and seeing how things develop. In particular, I found of interest the review of the rural allowance and the harmonization with regards to its geographic application from a health financing perspective. That's a very interesting equity item to consider. So I would be keen to see the outcomes of that. And yes, of course, Michelle, I work with on an ongoing basis, but I'm always delighted to see her presentations. Thank you so much for the opportunity to be with you all.
Great, thank you, Theodora. Michelle?
Yeah, so I'm happy to add my appreciation onto Theodora's appreciation. I think that a few things that I was thinking as we were going through is that the other kind of missing M, along with motivation, could potentially be that element of measurement, right? And how we really do need to be following these through, not just are they implemented, but how are they actually achieving the ends of increasing health worker densities in particular areas, and then how those increases in densities are in turn contributing to better health outcomes and maybe even better economic, better social, better outcomes in a more general sense. So inspiring to hear the work that's happening in South Africa, inspiring always to be with you, and thank you very much.
Thank you very much, Michelle, and thank you very much to everyone who's been part of the webinar this afternoon. Stacey Blows put in the chat a link if you would please give feedback on it and click on that. This is the last of the Global Health webinar series for this year, but certainly it will carry on next year. And thank you very much to Ritika Tawari and to Chanel Windvogel, and also to Yusuf Chikta for setting this up and making it happen. I'm sorry that we couldn't spend more time on discussing some of the issues that came up, but it was certainly a great set of presentations, as been said in the chat, and really valuable time spent together. So thank you again to everyone for presenting, to Michelle, Theodora, Caressa, and Maggie, and to everyone for joining us, and enjoy the rest of your afternoon and evening. And I should say, as some of you might have seen earlier, that the recording will go on the Global Health Department website, which is part of the SU website. And the link was there, but if you search for it, you'll find it easily. And goodbye to everyone.
Thank you.
Thanks.
Thank you so
Bye-bye.
much.
Thank you.
Bye.
Thank you. Bye.
Thank you, everybody.
Thank you. Bye-bye.